Hi everyone, we're going to carry on our lesson 2.2, Health and Human Rights here. On Moodle, we discussed human rights, we discussed the Universal Declaration of Human Rights, and also we looked at some key questions about the right to health. What services and goods should be guaranteed to every person under human right to health? What are the responsibilities of governments? What's the responsibility of the Canadian government to other people beyond their borders? And what kind of global governance is required to ensure health for all in their populations? So the most fundamental human right is the right to life. Human survival is dependent on having enough food, water, and air to support physiological processes and having sufficient shelter and clothing to protect the body from external exposures. These basic human needs are incorporated into the SDGs. Because drinking water is something that everyone requires on a daily basis just to survive, access to water is considered to be a human right. This does not mean that everyone has a right to an unlimited amount of free water, but it does mean that everyone has a right to an adequate quantity of clean water for consumption and hygiene at reasonable cost. This is pretty common in low middle income countries where there is a lack of clean water, and if there is clean water, it's typically the women or the young girls who are traveling to get the water. These young girls will not go to school because they will be the water girls. And I've seen this time and again in Ghana, seeing these young girls travel to get water. So this is the water issue. Water privatization is another issue. And so these water privatization schemes are generating concerns about how to guarantee that the poorest residents can access safe drinking water, since these large multinational companies are taking most of their clean water. By privatizing water, the citizens lose this voice in the matter because whatever contract their government has signed, that private company has complete control with no way for the people to change it. Oftentimes, these low middle income countries will do anything to try and boost their economy, and selling water is one way they can do that. Problems with ensuring equitable and affordable water access are not limited to just low middle income countries. We know our First Nations have had an issue with clean, safe drinking water for a long time. And it is one of the greatest violations of the UN human rights to water and sanitation. There's about 100 First Nations that have suffered from a water crisis in Canada. And despite the fact that Canada has the world's third largest per capita freshwater reserve, the water many Indigenous communities depend on is contaminated, difficult to access, or is at risk due to faulty treatment systems. Let's move on to access to health services as a human right. So the right to health care is one of the many human rights recognized by the UDHR. Several key criteria are used to evaluate access to health, including availability, accessibility, affordability, acceptability, and quality. The right to health does not mean the right for everyone to have access to every health resource on demand. The economic reality is that most health systems cannot provide organ transplants to everyone who needs one to stay alive, or expensive high-tech cancer treatments for everyone whose life could be could be extended by them. But there are certain basic right to health services that are required across all countries. And we will focus in on this when we watch the film Bending the Arc. So the level of access to quality health services is a major social, economic, and political concern in countries across all income levels. Every country has to make decisions about what healthcare services should be provided and who should pay for those services, and these decisions have human rights implications. Sustainable goal number 3 looks at ensuring healthy lives and promoting well-being for all at all ages. Some of the barriers to meeting Sustainable goal number 3 is the health workforce. At present, there is a very uneven distribution of healthcare workers across the globe. The number of people each clinical care provider has to care for is much higher in low-income countries than in high-income countries. Skilled healthcare professionals in low-middle-income countries must serve many more people than clinicians in high-income countries. Mental health workers per 100,000 people is very low in low-income countries. You can see this. Even in high-income countries, the mental health workers per 100,000 people is only 50. Dentists per 10,000 people is very low in our low middle income countries. Most people in low middle income countries do not have timely access to safe and affordable surgery. And so these are all issues with access to care, and are these human rights issues? One of the factors contributing to these inequalities in access to human resources is brain drain, which is the migration of healthcare professionals trained in low middle income countries to higher paying jobs in high income countries. The low middle income countries bear the cost of training these clinicians, and high income countries reap the benefits of that investment in education. And that is why Nursing Now and the WHO and International Council of Nurses has deemed 2020 the year of the nurse and the midwife. And because they've figured out that the health SDGs will not be able to be met by 2030 if there's not a rapid expansion of healthcare providers, and specifically nursing and midwife. Let's move on to access to medications or medicines as a human right. I want to talk about what a patent is. So a patent is the exclusive rights to sell the new product, and in this case medicine, for at least 20 years before a generic product can be made. And so the patent provides the company with a window of opportunity to make a profit and also to recoup any research and development costs in developing this new product. The World Trade Organization is a UN organization that negotiates and enforces trade agreements between UN member nations. And one of these trade agreements is the TRIPS agreement, trade-related aspects of intellectual property rights. And it protects these patents and copyrights across national boundaries. There are pros of having a TRIPS agreement. So the benefits of regulation is that it ensures the quality of the product. There's no counterfeiting of drugs going on. But the limits of the regulation is that generic drugs cannot be made until the patent is finished. And so generic drugs usually cost less than brand name drugs, but they cannot be sold legally until after the expiration of the patent. And this is usually about 20 years. So you can see the human rights issue with individuals in low middle income countries not being able to afford certain medications. An essential medication is a drug that's been identified as a high priority for a country's health system to have in stock at all times because it is a cost-effective treatment for common health issues. So in most low-income countries, the national formulary includes about 400 drugs, whereas in high-income countries, it's about 14,000 products. 1,400 products are on the list of approved and available drugs. Concerns about access to essential medications in low middle income countries became a prominent global health issue as the HIV/AIDS epidemic expanded in the 1990s. New antiretroviral medications that were saving lives in high-income countries were too expensive to be widely dispersed in low middle-income countries. And this led to a huge outcry by advocacy groups as a human rights issue. And so pharmaceutical companies and governmental health agencies and advocacy groups work together to make patented medications available at lower prices for low middle income countries. The 2001 Doha Declaration clarified the relationship between TRIPS agreement and public health, noting that the TRIPS agreement does not and should not prevent members from taking measures to protect health or public health in their countries, and that countries facing a national emergency or other circumstances of extreme urgency can issue compulsory licenses for generic drugs to be manufactured locally. So these are some of the things, barriers that have been overcome with essential medications. So we think about distributive justice. This is the ethical principle that needed resources in a population should be fairly allocated. The right to health in the UDHR implies that anyone who has signed that agreement has an ethical responsibility to expand the availability of vaccines, diagnostic tests, and medicines that are free or low cost for people who live in low-income countries. So this is the part of being an advocate, and for Canada being an advocate, to think about people beyond their borders. Another way to look at providing medications to low middle income countries is through private-public partnerships. So a non-for-profit organization can team up with a government in a low middle income country and invest in that country and develop or manufacture a product created primarily for its use in low middle income countries. And the reason that this can work is that for-profit companies are unlikely to invest in this because it's not going to generate a great revenue for them. So let's look at other vulnerable populations. Oh, I spelled that wrong, populations. So some of the other vulnerable populations would be individuals in natural and human generated, individuals, I'm just going to go back here, individuals in natural and human generated disasters. And these can lead to urgent humanitarian situations. So our climate change problems or outcomes, the outcomes of climate change are impacting people in the most vulnerable settings. And so individuals here in a flooding situation. And so both natural and human generated disasters can lead to urgent humanitarian situations. And the critical needs immediately after any humanitarian incident, as in this case, are water, sanitation and hygiene, food, shelter, and essential health services. Another natural disaster that's brought up a lot of human rights issues is the COVID. And as it says here, human rights are more important than ever in times of crisis. And we will discuss human rights in COVID in another module. Complex humanitarian emergencies. So these are wars and civil conflicts, and they typically will restrict access to health services and any of the tools for health. And it occurs when civil conflict or war causes mass migration of population, it causes food insecurity and long-term public health concerns. And so these are human rights issues related to health access. Prison health. On a given day, nearly 10 million people across the globe are incarcerated. Incarceration may exacerbate existing health conditions and create new health problems. Prisoners are entitled to all fundamental human rights, and they have a right to be protected from medical neglect, starvation, abuse, forced medical experimentation, and other civil rights violations. Contracting potentially life-threatening infections is not a part of any prisoner's sentence, and it is considered unjust not to provide incarcerated people with medical and dental care, adequate nutrition, protection from infectious diseases, and safe conditions. Lastly, I want to discuss people with disabilities. So what is a disability? Well, it stems from impairment. So impairment is a problem with an anatomical structure, mental or sensory function, or physiological function that limits the capacity of an individual to do a task or an action. A disability occurs when an impairment leads to restrictions in activity and participation. And disability is the result of both an impairment, but also the social and environmental context in which a person with impairment interacts with other people in the world. So this is the key part. About 15% of the world's people have a moderate or severe disability. People with disabilities are entitled to all of their human rights, including the right to be treated with dignity, to have the autonomy to make decisions for themselves, if they are cognitively capable of doing so, and to be active members of society. And from the Rick Hansen Foundation, 90% of Canadians agree that accessibility for people with physical disabilities is a right, not a privilege, but there is still a clear prejudice in how disabled people are treated. So when we think of disability and the environment, we think of the ADLs and the IADLs, which allow for self-care and independence. And the environment and resources available for people with impairments plays a key role in how well those individuals can navigate routine tasks and their independence. A condition that might be preventable or treatable in a high-income country where rehab and assistive devices are routinely accessible might cause permanent disability in a low middle-income country. And this is also, I've seen this many times in Ghana. People with disabilities have an increased risk of living in poverty. And these economic factors are exacerbated when people with disability have limited access to public services, education, and employment opportunities that would enable them to have a higher standard of living. So we talked about these before, the socioeconomic status. And so a safe and accessible physical environment and a strong social network are critical for maximizing the activities and social participation for all people who have impairments and disabilities. So now what? Well, global health is founded on the principles that all people have the right to the highest attainable standard of health. Advocating for everyone's human rights is a core part of achieving that shared goal.